A Toronto hospital is facing controversy tonight. It's over a pilot project to bring medical patients from abroad to Canada. Sunnybrook Hospital in Toronto insists it's another way of generating income. But as Mike Drolet tells us, opponents believe the program could do more harm than good.
Canada's publicly funded healthcare system, rich or poor, you get the same service. Now, Sunnybrook Hospital in Toronto is trying something that has the potential to change the game: medical tourism.
We certainly do like our healthcare politics in Canada, and it's a fascinating and important issue.
It's a pilot project. So far, 2 patients have been seen out of a maximum 10 for the year. They pay cash, and most importantly, Sunnybrook insists they're not cutting any lines.
Public trust is really important. Is this going to, will this reduce the average person's trust in the system or not? That's why I think we need to know more about it and hear more about it in the months and years ahead.
The top 5 medical tourism hotspots in the world are Singapore, Brazil, India, and Thailand, with Malaysia the #1 destination, which sees over 500,000 foreign patients every year. Canada is nowhere to be seen on that list, missing out on its share of a $40 billion a year industry. In Canada, Toronto's University Health Network is the destination for international patients. 380 have been treated since 2011, although they're sensitive to the term medical tourism and all the criticism that comes along with it. Repeated requests for interviews were denied, although in a blog posted on its site, a leading doctor argues that the funds raised get pumped back into the system. In general, we are able to treat 2 extra Ontarian patients off the waiting list every time we treat an international patient, writes Dr. Bob Bell. Our program shortens wait times for Ontarians by allowing us to open more operating rooms and beds.
And I hope that's true. But, the day may come where we're going to have some kind of provincial oversight into this, because it seems like, it's not too clear exactly how it's going to be done, and maybe it's being done in different ways by different hospitals.
And we'll go up.
UHN sells its program as more humanitarian focused. For example, at Ottawa's behest, it opened its doors to those wounded in the Libyan uprising. So the door is open. It's now a question of how far it will swing.
Let's not kid ourselves. Behind some of this push to open the doors to greater medical tourism are the people who would like to provide more for profit outside the healthcare system.
And that's making a lot of people nervous. Mike Drolet, Global News, Toronto.